Welcome to the Royal Cornwall Hospital Weight Management and Bariatric Service. This video is an introduction to the service, read by myself, Regan Crockett, Alison Buckingham and Rachel Baker, who are dietitians in the service. The purpose of this session is to help you decide if you wish to continue with the assessment process for bariatric surgery. To help you decide, we are going to tell you all the steps of our patient journey, describe the 3 types of bariatric surgery offered at the Royal Cornwall Hospital, and what you would need to do next. Before starting your journey towards bariatric surgery, it is important to ask yourself some questions. Is it really the right time for me to be thinking about bariatric surgery? Sometimes life events can take up most of our energy and there isn't much left to be able to think about making changes to our eating habits. Remember, if now isn't the right time, you can be re-referred by your GP when you feel ready. Am I able to commit fully to the process? You need to be able to commit to attending appointments without lots of cancellations or non-attendances, and to actively participate in groups and be open to take new challenges. Do I meet all the criteria? We will discuss the criteria for bariatric surgery later in this video. Am I willing to participate fully in all the learning activities? The COVID-19 outbreak has meant the service has had to offer more virtual appointments and groups. During these, you will be asked to complete challenges between sessions in order to support your journey. We expect people to be able to fully participate in order to get the most from the service. Should I consider an alternative to bariatric surgery? Many people coming through the pathway have exhausted all other avenues to help them manage their weight, and we hope that surgery will provide the help they need to get started. Surgery isn't right for everyone, and some people decide it's not for them. In this case, we might be able to signpost you to a different service that can support you. You might want to write your answers to these questions down and review them at the end of the video. Let's meet the team. Often the first person you meet in the pathway is one of the endocrinology consultants. We have 2 consultants in our service, Dr. Creeley and Dr. DeGal. Usually when you have your first appointment with the consultant, you will also get an opportunity to talk about your physical activity goals with our exercise specialist, Christopher Cleater. There are 4 dietitians who work in the service, myself, Regan, and we also have Leanne, Alison and Rachel. Most of the appointments you have in the pre-surgery part of the pathway will be with the dietetic team. You will also get an opportunity to speak with a psychologist. There are 2 psychologists in the service, Tim and Carly. Once you have been referred into the bariatric surgical service, you will meet the specialist nurses, Jeremy, Toby and Louise. They will provide most of your post-surgical care. Gail is our bariatric service coordinator. You may speak to her about waiting times and appointments. We currently have 4 surgeons who perform the surgery here at Royal Cornwall Hospital. We have Mr. M. Clark and Mr. J. Clark, and also Mr. Cota and Mr. Finlay. We are now going to talk you through the full patient journey within the service so you know what to expect. There are 10 steps in the pathway taking you from your referral to your after-surgery care. You are currently at step 3. The first step is your referral into the service. Hopefully, you were able to speak to your GP or other healthcare professional about bariatric surgery and they referred you into the service. You would then have had an initial appointment with the endocrine consultant. Normally, people will have 2 appointments with the consultant in their journey. At this step, you may also have had a chance to speak with Chris about your physical activity goals. Step 3 is where you are now, your appointments with the dietitian. We're going to describe this step in more detail. Step 4. Once you have completed some of your appointments with the dietitian and confirmed that you want to continue, you will be referred to the psychology team. You may have between 1 and 8 appointments depending on your individual situation. Step 5. Once you have completed all your appointments with the consultant endocrinologist, the dietitian, and the psychologist, and we all feel that you're a good candidate for surgery, the consultant will refer you to the bariatric surgical team. If you have not completed all the necessary appointments, do not fit the criteria, or have struggled to make the necessary changes to your diet, you might be discharged from the service at this point. If your situation changes, you can be re-referred after at least a 6-month break to be reassessed. Step 6 is your first appointment with the nursing team. This will either be a group session or a video to give you more detailed information about the different surgeries. After having this information from the bariatric nurse, you will move on to step 7. This is your surgical assessment appointment. Here you will meet the surgeon, the anaesthetist, and the dietitian. There can be 3 outcomes from this appointment. 1. You will be added to the waiting list for a surgical date. 2. You will be required to have some further medical tests or attend further appointments with the dietitian to meet a weight loss target before being added to the surgical waiting list. 3 is you are discharged from the service due to not being suitable for surgery. This happens only very rarely. Once you have been added to the waiting list, you will get a date for surgery. Step 8 is following the liver reduction diet. We will tell you more about this later in the video. Step 9 is coming into hospital and having your chosen surgery. And the last step, step 10, is committing to all your aftercare. You will have some routine appointments at regular intervals with both the specialist nurse and the dietitian within the first 2 years following surgery. Depending on the surgery, you might have around 10 to 12 appointments within the first 2 years. We would like to give you some more details about step 3 of the journey, your appointments with the dietitian. You would have already had a telephone screening appointment with the dietitian to gather some information and answer any questions you have about the service. You were then signposted to this video. At the end of this video, it is important that you contact the team via email by the date you were given. If you have not contacted us by this date, you will be discharged from the service. By contacting us, you are confirming that you are ready to continue, and you will arrange to attend 4 virtual group sessions. After completing all of these sessions, you will then have between 2 to 4 one-to-one appointments. It is likely these will be virtual appointments, but we have a limited number of face-to-face appointments available if required. After all these appointments are completed, a decision will be made to support your referral into the surgical service or not. This decision is based on your engagement with the service, your understanding of surgery, and changes you have made to your diet and changes you have made to your weight. Here are some more details about step 8, the liver reduction diet. 2 weeks before having your surgery, you will be required to follow a strict diet. This diet will reduce the size of your liver by releasing stores of energy called glycogen. Having a smaller liver means the operation will take less time and there is less risk of complications. Most people will choose between 2 options. Option 1 replaces all the food you normally eat with fat-free yogurt. You can have up to 7 or 8 small pots each day. Option 2 will replace all the food you eat with semi-skimmed milk. Your allowance will be 3 to 4 pints each day. With both these options, you will also need to drink plenty of calorie-free fluids and take a vitamin and mineral supplement. You can also include 1 portion of sugar-free jelly and 1 Bovril or bouillon drink each day. If you cannot have milk due to lactose intolerance or a cow's milk allergy, a dairy-free option can be discussed with your dietitian. If you are thinking about bariatric surgery, you first need to fulfill the standard criteria. The criteria is having a BMI of greater than 40 or a BMI of greater than 35 with weight-related comorbidities such as type 2 diabetes. If you're not sure of your BMI, we can check this for you. Surgery should not be the first-line method to lose weight. You should have tried other methods such as commercial slimming groups or support from your GP. You might not know if you're fit and well enough to have surgery until assessed further in the pathway by the surgeon and anaesthetist. If you meet the standard criteria, then it is likely that you will be able to be referred into the pathway. In order to complete all the steps and be supported to have surgery means you will also have to meet the service criteria. The dietetic criteria is that you should be willing and able to follow post-surgery dietary recommendations, show understanding of the different types of surgery, show commitment to attending appointments, and have the ability to stabilise your weight or demonstrate some weight loss. The psychological criteria are that you should have no unstable mental health conditions, no ongoing issues with substance misuse, no occasion of eating disorders or self-harm in the previous 12 months, and an emotional stability to cope with surgery. If one or more of the exclusion criteria apply, then you need to consider other options first. Other options include self-referral into the Healthy Cornwall service, add action if you have substance misuse issues, Outlook Southwest for support with mental health conditions, commercial slimming organisations, referral into the community mental health team for eating disorders, and Healthy Outlook, which will need a GP or healthcare professional referral. The assessment process for bariatric surgery can take some time and effort. It is expected that you will be able to attend a number of appointments throughout the process. Repeatedly cancelling appointments or non-attendance at appointments increases waiting time for other patients and may lead you to being discharged. Attending appointments isn't enough. We also expect you to be able to fully take part in any group work and activities, as well as do your own research into bariatric surgery. Life can be complicated and lots of things may compete for your attention. Significant life events like moving house, changing jobs, a bereavement, or dealing with medical issues, mental health distress, or pregnancy will likely mean that it is not a suitable time for you to be thinking about bariatric surgery. You may want to be re-referred to the service when things have settled. Your next step is to consider the following 4 questions. Do you meet the service criteria? Have you placed improving your health as a high priority and are willing to put in the time and effort? Are you coping with the other stressors in your life? Do you feel able to commit fully to all the appointments? If you have answered yes to the 4 questions, then bariatric surgery may be the right choice for you. To continue, you must now contact us by the date agreed with your dietitian, which is usually 3 weeks following your first appointment. Contact us by either email or telephone. Our email address is rcht.bariatricdietitians@nhs.net. Our telephone number is 01872 254569. All messages must include your full name and date of birth or hospital number. Without your date of birth or hospital number, we will not be able to securely identify you, and it could lead you to being discharged accidentally. Remember, if you don't contact us, you will not receive any further appointments. Any email message or any telephone message should contain 2 types of identification, e.g. your name and hospital number or date of birth.
The second part of this video will explain the basic information about the 3 surgeries that are offered at the Royal Cornwall Hospital. This includes the adjustable gastric band, the Roux-en-Y gastric bypass and the sleeve gastrectomy. We will briefly outline how each of the surgeries work and offer a comparison of the surgeries to help you make an informed decision. The gastric band is placed around the very top of the stomach. Attached to the band is a piece of thin, flexible tubing which connects the band to the access port. The port sits at your midsection and is underneath your skin and can't be seen. Inside the band is a membrane that can be inflated like a balloon. To adjust the tightness of the band around the stomach, a needle is placed through the skin and into the access port, and saline solution is injected into the band. The more solution that is in the band, the tighter it becomes. This means that food takes longer to pass across the band and into the stomach, helping you to feel more satisfied on a smaller amount of food. More fluid in the band does not necessarily mean better weight loss. It is important to get the band adjusted to the correct level for the individual so they experience increased satiety and can still eat comfortably. Having a gastric band is a very safe operation, and most people are only in hospital for a few hours. The operation is relatively short, generally taking less than 1 hour, and most people will take 2 weeks off work to recover. During a gastric bypass operation, a smaller stomach pouch is created from the top part of your stomach. The pouch is then connected to your small intestines. Food will pass through the small stomach pouch into the lower part of the intestines, bypassing the rest of your stomach and the first section of intestine. The surgery works by affecting some of the hormones which control your appetite. You may have very little appetite for the first 12 to 18 months after your surgery, and you should feel satisfied sooner and on smaller quantities of food. Most people who have a gastric bypass surgery will need to stay in hospital overnight and occasionally for longer. A gastric bypass operation typically takes 1 to 3 hours, and most people will take about 4 weeks off work to recover. During a sleeve gastrectomy operation, the outer portion of the stomach, around 75%, is removed to create a thin tube. The valve at the bottom of the stomach and the intestines beyond this remain intact. As part of the stomach is removed, there is likely to be a reduction in appetite hormones. This means that you may feel less hungry and more satisfied with smaller portions. Similar to a gastric bypass, most people will have an overnight stay or occasionally longer in hospital and will take around 4 weeks off work to recover. Bariatric surgery is an effective way to help people lose weight and has a good safety record. However, before having surgery, you need to consider the risks. The risk of dying, the mortality rate, by having bariatric surgery is very low. You will be assessed by the surgeon and the anaesthetist, and if the risk is too great, then surgery may not be an option for you. Every surgery carries some risk, and this could include infection, blood clots, bleeding, and swallowing problems. To minimise the risk of blood clots, you will be required to wear compression stockings and take blood thinning medication for a few days after your surgery. With a bypass and a sleeve, there is a risk that around 2 to 5 people in every 100 will develop a leak along the staple line. This can mean further surgery and a longer stay in hospital. The risk of needing a further operation generally decreases once you have recovered. However, if you choose to have a gastric band, there is a 10 to 20% chance that you will need another operation in future. This is typically to replace or to correct the position of the port, or it could be to have the band removed if the band has moved or the stomach pouch is dilated. Serious complications after a gastric band are rare. Reoperation rates are similar after a gastric bypass and sleeve gastrectomy. You may require an operation if you develop gallstones, a stricture or narrowing, a hernia at one of the incision sites, or a blockage of the bowel. If you continue to smoke, you are at increased risk of developing an ulcer, which can take a long time to heal. As a sleeve gastrectomy can increase the risk of reflux, a further operation is sometimes required. Longer term, there are potential complications to consider for each surgery, and these include the potential for weight regain, swallowing issues, reflux, vomiting, and abdominal pain. Following a gastric bypass and sleeve gastrectomy surgery, there is also the possibility of dumping syndrome, nutritional deficiencies, and food intolerances. This is not an exhaustive list, and it is not possible to say which, if any, issues you will experience. Weight loss after bariatric surgery is usually reported as percentage excess body weight loss. This is calculated by working out the amount of excess weight you are carrying before surgery and then what percentage of this you lose. Your excess weight is calculated by subtracting your weight at a BMI of 25 from your current weight. For example, if Joe had a BMI of 25, they would weigh 72 kilograms. Joe's current weight is 130 kilograms, which gives Joe an excess weight of 58 kilograms. The green line shows the weight loss after a gastric band. This tends to be slow and steady. At 12 months after surgery, a typical result is to lose 30 to 40% of excess weight. Some people can continue to lose weight and achieve a 50% excess weight loss by 3 years after surgery. So in the example, Joe would weigh 101 kilograms with a BMI of 35 3 years after surgery. The blue line shows weight loss after a gastric bypass. Weight loss tends to be faster in the first 6 to 9 months and slows after this. At 12 months after surgery, people can typically achieve a 70% excess weight loss. Some weight regain is common after 18 to 24 months post-surgery, so a typical result at 3 years after a bypass is a 60 to 65% excess weight loss. In the example, Joe would weigh 92 kilograms with a BMI of 32 3 years after surgery. The orange line shows weight loss after a sleeve. The weight loss is faster than a gastric band in the first 12 months and tends to plateau after this. At 3 years after a sleeve gastrectomy, a typical result is to lose 60% of excess weight. So in the example, Joe would weigh 95 kilograms with a BMI of 33 3 years after surgery. So as you can see, after the initial 2 years, the weight loss results after each of the surgeries are fairly similar. Your health is not defined by numbers on the scales, and weight loss is only one way to measure results after bariatric surgery. It may be more important to focus on improvements to medical conditions, reductions in medications required, improvement to fitness levels, and improved well-being and quality of life. If you have bariatric surgery, you will need to take some vitamin and mineral supplements and have annual blood tests. If you choose to have a gastric band, you will need to take one good quality multivitamin and mineral supplement each day. These are often called A to Z supplements. You may be required to take other supplements, but these will be recommended in relation to your blood test results. A bypass and sleeve have the same vitamin and mineral regime. You will need to take 1 or 2 A to Z vitamin and mineral supplements each day, as well as calcium with vitamin D and an iron supplement. You will also need to have an injection of vitamin B12 every 3 months. Choosing which bariatric procedure is best for you isn't easy. All 3 surgeries are performed via keyhole or laparoscopic method. And although they have a good safety record, there are risks both at the time of surgery and later on. All of the procedures require commitment to making changes to your diet and can result in weight regain if you are not able to follow the dietary recommendations. There is no one best surgery. Each has its merits and disadvantages. Bariatric surgery is a tool to aid you in improving your health and will rely on you using it correctly. We are going to end this video by checking your understanding with some true or false questions. Firstly, you can't regain weight after bariatric surgery.
This is false. There's about 20 to 50% chance of regaining weight after any of the 3 operations.
I won't be able to eat chocolate, cake, or crisps after surgery.
This is false. If you choose to eat these foods, you will still be able to. Often these foods go down very easily after surgery. Some people may find that fatty and sugary foods can cause issues after eating them.
Losing weight will mean that all of my physical and mental health issues will be cured.
This is also false. Losing weight may mean an improvement to many of your physical and mental health problems, but some issues are not due to weight. It is important to be realistic.
Coming to all of my appointments will be enough to allow me to have bariatric surgery.
False. Attending your appointments is a good start, but you also have to make all the necessary changes to your diet in preparation.
With some hard work, bariatric surgery is a very effective tool to help with weight loss.
This is true. Bariatric surgery has been shown to be one of the most effective ways to help people to lose weight.
Thank you for your time in watching this video. Please remember, if you would like to continue the assessment process for bariatric surgery, you must now contact the dietitians. Contact either by email at rcht.bariatricdietitians@nhs.net or by telephone on 01872 254569. Your message should confirm that you have watched this video and would like to be considered for bariatric surgery. Your message must contain at least 2 forms of identification, your name and date of birth or hospital number. If you were given dates to book in for your group sessions, you can also tell us your preferences. We will then send you an email to confirm the dates or to provide you with some dates to choose from. We look forward to hearing from you, and if you have any questions about the service, then please contact us on the number above. Thank you.